contact tracing is underway for more than 50 people said to have been in contact with some 2 persons who have contracted the viral hemorrhagic fever, the Lassa Fever. One of them, a 40-year-old trader who first contacted the virus and later died in the hospital. The second person is said to be a contact of a first case, which is, according to the Ghana Health Service, in stable condition. We'll tell you the steps taken by the Ghana Health Service to bring this under control. First, listen to the Director of Public Health at the Ghana Health Service, Dr. Franklin Asiedu Bekwe.
The news just talked about the fatality of about 1%, but I think it depends on when you seek medical intervention. And I need to state that there's an antiviral agent that can be used to manage the case. So what is most important is the ability to diagnose it early, and then you can be able to get the best outcomes. The reservoir is around, there may be areas that you may have it moving around. So it depends on the individual. Let me say that about 80% of persons who be infected with Lassa fever will not show any clear symptoms of any severity. So they may not even go to a hospital. But this one is a case that the person gets the fever and then went to the health facility, was seen as possible material, was managed, and then got better, and then went back, and then went on and on until she died. So this is a typical scenario or the cause of Lassa fever. So it presents like the fever, general body pains, malaise, and then we try to progress to headache, sore throat, dyspnea, difficulty in breathing, eventually have facial swelling, and then the last end is when you start having the bleeding. So that is not common to have it, but you can have it as it happened in our first case that unfortunately died.
So who is at risk of contracting this disease?
So far as I would say your environment is not that clean, that you are likely to have this the one which is the rat, then you are at risk, because usually it's like you have a leftover food, leave it in your kitchen, you go sleep, you come the next day, you don't know what's happening. You may have the rat coming onto that food, passing urine and droppings on it, and possibly you may not rinse it properly. Then you ingest, you may get infection. Or let's say you have some mangoes, you just leave it in your kitchen, you go sleep, you come the next day, you just take the mango, you are not washing it properly. This may be also a source of the infection. So what's the most important is about the environmental cleanliness. It's very important in this scenario of Lassa fever.
Let's bring in now Dr. Thomas Anaba, health specialist. And Doc, congratulations on your new journey. Of course, you're intending to enter Parliament by 2025. We'll talk about that exploit shortly. But how worried are you now about this latest outbreak that we're hearing of?
Yeah, very worried because symptoms are confusing. Most of our people would consider it to be something like malaria or typhoid, and by the time they say Jack, it is too late. So we need, as the director just said, we need to intensify education and campaign so that people will know the disease exists, or else we'll be confusing certain ailments with it, and the mortality would not be good for us.
And very quickly, let's take a look at what it is that the Ghana Health Service has been indicating about this, some of the measures being taken. I have that excerpts of it on your screens right now, talking about the health service and its measures briefly. First of all, there's the point that the Public Health Emergency Management Committees at all levels, the national, regional and districts have been activated, and then detailed investigations, including environmental assessment, has started. And then we also do know that essential medications and logistics, including personal protective equipment, PPEs, are being mobilized, and contact tracing and management are equally ongoing. Out of these measures as well, aside this, we know of the quarantine of some contacts which has been instituted and a daily follow-up by the health staff. It's actually ongoing. There's also strict infection prevention and control and sensitization as always, and community sensitization and education as well. Out of all of these measures that you've seen, I'm sure that you've read some of these measures. Are they enough to check against this outbreak that we're having?
They are enough, just that we need the public and the health facilities, those taking care of these patients, those doing the contact tracing, to be up and doing. The public should abide by the rules or the protocols that has been set out. Government is also to ensure that it provides health facilities with the needed equipment and medication. I think from the COVID-19 pandemic, we've learned a lot about how to manage epidemics and pandemics. So this one should be an exercise that has already been practiced. So I would expect that government does its part. I think the health facilities will be ready, except that if government doesn't provide them the needed resources, especially the PPEs, because you are at risk of treating somebody with it if you don't gown yourself well, and if you don't do proper PCR to make sure you don't transmit PCR, you don't transmit the infection to anybody or take it to your home or infect somebody on the transport when you are going home. So I think the onus lies on the public to be wary of themselves, on the government to provide the needed services, needed resources, and then the facilities to be also be in readiness, evoke the emergency preparedness plan for infectious diseases so that we can curtail this.
And for the general public, what are we to know about this Lassa fever?
Just like the director said, we are to know that the symptoms are not quite different from the usual malaria and typhoid we have, that generally anybody who has a fever would begin talking about malaria, going to look for malaria tablets to take, and then the rest. Please, if you have any symptoms of fever that is not being controlled within 24 hours, please go to the hospital and then let them examine you well and take care of you. That is what I would tell the general public. Don't auto-medicate for more than 24 hours. And make sure your hygiene in your house, the food you eat, and everything that you touch, you try to sanitize your hands and then the rest. And stay away from crowds if you don't need to be in a crowd.
And very quickly, how are we able to detect or spot from the outside that someone is suffering from the condition?
In fact, it is very difficult. Unless you are an expert, you go to the hospital for them to examine you for certain signs and symptoms on your skin, your airway, and then the rest. And then sampling taken, and then there must be a high level of suspicion by physicians. If you don't have that suspicion, you may miss it. That is what I would say about how we can diagnose it.
So your general caution is that anytime you suspect you have fever, you move to the nearest hospital?
If you have fever, you take paracetamol or anti-malaria, and you think that it is not working for you within 24 hours, don't extend it. Please go to a hospital. Let them examine you critically. Right.
But for the other health centers across the country, well, you may say that the GHS, that's the health service, will do its part, but we're talking about the health centers themselves and the management of those facilities. What other measures are they supposed to be on the lookout for?
For instance, any health facility that is out of Ghana Health Service and the rest, what I have to do is to put call up your emergency preparedness team or infectious disease team to get ready and start all the processes to receive any patients that come with any suspicion. Have a small room or an isolation room to be able to quarantine such a person. If you have the suspicion, then you can take samples and then the rest and start the treatment. This is what they should be doing. And I would also require that government should not leave private hospitals out in this. Whatever support they are giving to the government facilities, they should extend same to private facilities that bear some of the workload of the pandemic that we are just struggling with, that is the coronavirus, because private hospitals were left out. But I think that in this case, if we are really going to set up an emergency preparedness team to fight any outbreak of disease in Ghana, this time they should add private facilities to make sure that they also cover those who go to the private facilities.
And this report about health officials also contracting the disease. It comes as a worry to you as well.
No, sure, it must be a worry. As I've told you, if you don't have the needed protective gear to wear to treat patients, if you don't have this high level of suspicion, you may end up treating a patient not knowing it is the person is having the sickness. So the best thing is high level of suspicion and government providing them with the needed protective gear. Have enough water in the hospital to wash their hands, have enough sanitizers, have gloves to wear, even goggles for those who will be attending to people in the shields or goggles for those who will be attending to those patients in the private rooms or in the isolation rooms. All these measures need to be taken so that doctors and nurses don't get infested with such diseases and also fall as victims. So it is saddened to hear that doctors and nurses are falling ill, but that is the work we do. We are there to save patients until you have the suspicion and know that this disease exists. Sometimes you don't take the measures, but now that it's being announced that it is emerging, we will now take the needed precautions when we're attending to patients with the flu, with a fever that is not controlled, and then the rest.
Okay, then, let's calm down now. That's your passion, but I'm about to talk about your politics as well. You're seeking to get into Parliament. On which ticket and which constituency is this?
Oh, I am trying to go to Parliament through Garu constituency.
Right.
And on the ticket of the National Democratic Congress, NDC.
Wow. Are you certain of victory?
I am certain of victory, and the Lord would see me through.
For how long have you nurtured this ambition, by the way? Because many of us knew you to be that health expert commenting on health issues across the country.
As you know, anybody who has semblance of seemingly being a leader, looking like a leader, his people will approach him to represent them. And I've been approached to represent, and I'm doing just that. And I think I can do it. That is more important. I think I can do it.
And if you succeed, what's going to be top on the agenda for you, for the people of Garu?
When I succeed, the people of Garu have a lot of needs, but I've prioritized them. Health is one of the most important things they need us to solve, because we are deprived of health facilities, medical doctors, nurses, laboratory technicians, and then the rest. It's an agrarian district or constituency. We would have to look at how we can resource the farmers, get them the needed support to get the needed resources they need to improve upon their farming. We have a lot of youth who are going to school. Some of them, their parents are very poor. We may have to get some funds, get some endowment, get some scholarships for them to be able to go to school and come back and fulfill and fill in the human resource gap that we have in the constituency, so that there will be some improvement. These are the three main things I think I'll be doing when I get the nod. Okay,
then, let's see how it goes. Dr. Thomas Anaba, thank you for spending some time with us here on The Pulse.
Pleasure with me, Fred.
And we're grateful.